There are concerns about a new, fast-spreading COVID-19 subvariant that's becoming the dominant strain in the U.S. 5 cases of XBB 1.5 have been detected in British Columbia. But Bonnie Henry, BC's chief health officer, says Canadians have some immunity to the new variant.
Not taking off rapidly like they're seeing in the U.S., but it could happen. But I think we have some really strong protection here, from particularly because people have gotten vaccinated. Lots of people have got their booster doses, and we know that lots of people over the past summer, in particular and fall, have also had a bout of COVID. So that hybrid immunity gives us some protection.
Experts say the new variant may be fast-moving and more transmissible, though it may not cause more severe disease. For more on this, we're joined now by Dr. Samir Gupta. He's an associate professor in the Department of Medicine at the University of Toronto and is a respirologist, and he joins us today from Toronto. Good morning. Thank you so much for joining us, Dr. Gupta.
Morning, Hillary.
So let's start with this new COVID-19 subvariant. As we were hearing there, it's now been discovered in British Columbia, a few cases there. What more do we know about the variant at this point?
Yeah, we know a little bit about it. It really is taking over in the U.S. It's moving out prior Omicron subvariants, BQ1, BQ11 that we've spoken about. It constitutes more than 40% of cases, will likely be more than half of cases next time it's reported. And if something takes over like this, it's one of two things or a combination. It's either more infectious, it spreads more readily, or it's better at evading the immunity in the population, or both. And we know a little bit about it from lab studies. We know that it is more evasive to existing immunity than other variants that have been looked at. But what we don't know, you heard in that report, importantly, is whether it causes more severe disease. And at this point, that's what we care most about. We can expect that this will also take over in Canada if it hasn't already. At this time of year, we often do see more burden on the healthcare system, but that's at least partly because of human behavior, because we get together over the holidays, and then there's that lag effect where sometime in January, as we saw in 2020, after 2020's increase in December and after Omicron in December 2021, there's that burden on the healthcare system in the early part of the next year. So will that be because it causes more severe disease or just because there's more disease in the community? That'll be hard to tease out because we don't have a great feel for case burden. We don't have that testing data anymore, and we don't have as much wastewater data. So it'll take some time before we're able to figure that out.
And what about protection here? If this does become the dominant strain in Canada, the vaccines, the boosters that we have, are they going to help us?
Yeah, I think, what we do know from at least one lab study is that the bivalent booster shot with BA5 in it, the one that people are hopefully getting now, is better at protecting against XBB in general, and hopefully that extends to this XBB 1.5 than the original monovalent. So we know that this vaccine, the latest vaccine, is better. And as you heard from Dr. Henry there, also an infection with one of the more recent Omicron subvariants would presumably provide some good natural immunity. So I think it's just a good reminder for people to be up to date with their vaccine. If you haven't gotten it, go out and get your bivalent shot.
A good reminder for sure. Also want to ask you about China here, because China is now threatening some countermeasures to these new travel testing mandates that have been imposed by several countries. Canada, of course, is one of them. Are these sorts of mandates, rules, are they going to give us the ability to detect outbreaks?
Yeah, these kinds of things they just don't work, and the science just doesn't support them. And we've also kind of seen this now. The idea of banning travel from India didn't prevent Delta from coming here, or banning travel from South Africa didn't prevent Omicron. Variants will come in. I think this is more of a political move. I think governments understand that, using a test with a relatively high false negative rate and having people do that before travel will not prevent a new variant from coming here. If you really want to know what's happening with variants, then look at the wastewater in airplanes and at airports and look for what variants are there. And if you really are concerned about variants, then require people from the US, where we just talked about XBB 1.5. It's a known variant of concern. Then have them do testing. So I think this is more of a political move, and it's a move that's probably countries around the world are asking China to provide more information about what's happening in terms of cases, hospitalizations, ICU, and sequencing data. What kind of variants are they seeing? Because there's a concern that a new variant may emerge. But this won't stop it from coming in. I think it's a way to just hopefully get China to share more information.
Is there a way to stop variants from spreading in countries like Canada without bringing in new mandates? Things that, of course, the population has grown tired of in many cases. Is there a way to stop this, to try and slow down the spread without bringing in mandates again?
Yeah, I mean, I think, there's no one magic bullet. All of the things that we've been doing at various times in the pandemic will help reduce spread. And I think at this point, it's just being practical, right? If you're in an indoor enclosed space where there are a lot of people, then wear a mask if you can. It's easy to wear a mask. Wash your hands, keep your distance, try to improve ventilation. All of these things will help, but most importantly, protect your own self against severe disease by going out and getting vaccinated. We will see new variants. All of those measures will practically help reduce their spread, but to protect yourself from getting really sick, the most important thing is to go out and get your booster shot.
Okay, and just finally here, another little thread I want to pick up on, because France is introducing some specifications requiring for clean air in classrooms. We've talked about ventilation and purification a lot over the past couple of years. Is that something that you think can and should be adopted in classrooms in this country?
I do. I think it's a really progressive move. It's the first country that I think has taken such a sort of comprehensive national approach. And we've mostly focused on masks and distancing and hand washing. And we've always mentioned ventilation, but it's a harder one because it's something that you don't control for the most part. You can't do much about. You can't control the ventilation that your kids will be exposed to in daycare or in schools. And what France has said is that they're going to impose a requirement for testing the quality of ventilation in schools and daycares, and it's going to be with a simple tool called a CO2 monitor, because basically we all breathe out CO2, so the more CO2 there is in a space, sort of a proxy for how well ventilated that space is, and the higher the CO2, the more other people's air you're breathing in. And so they've set cut points to say above this level, there have to be mitigating strategies because the ventilation just isn't good enough. So that means every space will be tested. And then mitigation will come into those spaces. And that means a huge investment in HVAC. It really is an infrastructure type of investment. And it's a bold move, and it will have dividends for this pandemic, the next pandemic, and other respiratory diseases, which are so often spread in that environment. So I'd love to see us do that. And many people have been calling for Canada to do that as well. So hopefully, we can model what's happening in France now.
Okay. Dr. Gupta, thank you so much for everything this morning, for walking us through a couple different topics there. We appreciate it.
My pleasure.